Get started. All right, thank you everyone for coming back. I feel honored and privileged to present Dr. Susan Salahshor. She is a physician assistant for almost 30 years with experiences in multiple medical and surgical specialties. She is the founding director of Ithaca College PA Program in Upstate New York. I have the pleasure of knowing her from the African Heritage PA Caucus. And Dr. Salahshor is also a mental health first aid instructor. She's certified to instruct adult, youth, higher education, military, and service members. She leads mental health wellness talks to help improve individuals to develop a self-care plan that is practical and achievable. So Dr. Salahshor, I'll let you take it away.
Good morning, everyone. Great to meet you all, and thank you for having me. Thank you for the invitation, Karina. Karina's almost seen this entire presentation before, and it never gets old because it can be applied no matter where we are in our lives. And I want this session to be interactive. The biggest thing is I want to meet your need, and I can't meet your need if you don't tell me what your needs are. You have my email. I'm going to ask Karina to put my cell phone in the chat. I give PA students my cell phone for the very transparent reason of email sometimes is getting clogged up being a program director now, but I want students to know they can reach out to me that I can find support, give them support via text, do a quick chat. It's so much easier. I did this when I was in patient care, gave my patients my cell phone, said, call me if there's a problem. And they call and we solve the problem versus them going to the emergency room and the problem was too big for everyone to manage at that point. So I'm very comfortable giving you my cell phone number for you to reach out if you want to talk further. I heard Dr. Tabb's presentation. You can call me Dr. Susan. Sometimes people struggle with my last name. And I want to say, I think it was fitting that you heard about burnout first before we talk about mind, body, and soul as you're in PA school. And I developed this talk about 2 years ago, just after George Floyd's death, in fact, because I've been teaching mental health first aid. And I had a school in Florida, a historical Black college, that I usually teach mental health first aid, higher education to them, to help their staff, students, and each other really to navigate some of the challenges being in higher education. And they came back to me and they said, you know, we're in crisis. We need help. We need help as faculty and staff, and we want to support our students. How do we do that? So I switched to mental health first aid, mental wellness talks. And in that, one of the things that came out of it where people were like, what can I practically do to really take care of myself as I'm taking care of students and staff? So this talk is built around this idea of we need to take care of ourselves, because if we don't, we will become burnout. And when we are burnt out, it is then too late, and we do need to access mental health resources. Full disclaimer, I'm Jamaican born, hyper Christian raised, hyper religious raised, converted to being a real human being when I moved to this country. So all those things are very different about me now, but I do believe in a higher power. I do believe in Jesus. I know others do not, but I want to say that so you understand some of the conversations I'll have with you. I have people in my family with mental illness that were never diagnosed because of the stigma associated with this in our country. And I do a lot of talks to military folks because of this, because of the stigma associated with it. So I want to just put that out there so you're aware. All right. Do I have the power to share? I do. This is awesome. I'm just going to swap and share. And are you seeing that?
Yep, can see it.
I don't want to show you this screen. Hold on. Let's just make it smaller. All right. All right, there we go. So this topic, I took it from my daughter, my 13-year-old daughter. She was talking to me one day after we had been traveling in the car for a while. And she said, I was having a conversation. She said, you know, Mommy, you really need to start thinking about YOLO. And being a 50-year-old, almost 50-year-old, I had no idea what YOLO meant. And so she then proceeded to tell me that YOLO, as you all know, is you only live once. And so because you only live once, we have to make sure our mind, body, and soul is okay in PA school. As you heard, I'm a founding program director, so I started the program at Ithaca College, and I teach in the program. So I want to preface that to tell you some of the things I'm about to tell you should be very helpful to you. Are you seeing the screen with just one slide? I want to make sure.
No, I was just about to tell you, I think we have to switch it back to how you had
All
it
right.
before.
There we go. Is that it?
Yes.
There we go. All right. So this is the goal. Meet your needs, discuss what you're doing currently, because we need to know what you're doing to see if it's working. We need to know what the barriers are. And I suspect most of the barriers, but we'll see what you have to say because things could have changed. And then create a realistic self-care plan. That's the ultimate goal. I've sent Karina a PDF of some breathing activities that I think you can pick something from to just use as you're in PA school, because there's so many options and so many choices. So I kind of dwindle it down so it's more manageable for you, and then tell you about resources and tools that you can use to avoid burnout because you only live once. We're going to use VVox for interaction for just a couple of questions. Let's see if it works. Dr. Salahshor loves technology, but it doesn't always work well for me. So if you could take a picture of that. And the first thing we're going to talk about, should not be a surprise to you, is sleep. How many hours of sleep are you getting in PA school? And be honest, because we need to bring our authentic self to this conversation so we can be set up for success. As you can tell, I've been a PA almost 30 years. When I went to PA school, we did not have all the tools and technologies you have. We didn't have TikTok. We didn't have Facebook then. So you have a lot more competing things happening for you. Let's see. All right. Let's see. All right. Whoa. Okay, so we're going to pause. I want to talk to the people. Well, let me rephrase that. I want to talk to the PA student who's sleeping more than 8 hours. Would they be willing to share how they're doing that? Anyone willing to share how they're getting more than 8 hours of sleep?
I think that one is for 7 hours. It says 8 or more, 0%.
Okay. All right. So 5 hours, 6 hours, 7 hours. Okay. All right. So what does sleep do? Sleep heals your body, and we need our body, our brain, right? We need our brain to function in PA school. It reorganizes the brain. So it goes back to when you think about studying. I have my learners say to me, I call my student learners, say to me all the time, Dr. Salahshor, I didn't sleep because I had to study. And I said, and how much studying did you get done after 10 o'clock? Probably not a lot, because you were reading the same material over and over. And sleep also helps relieve your stress. So sleep is really important in your wellness journey. Sleep is really important in your self-care plan. And sleep is even more important when you're studying for an exam. So just keep that in mind as you think about the physiology of sleep and what sleep does to you. We're going to do a little activity, and I hope this will help you. Even I use this technique for test taking anxiety with my learners. If they're having a stressful week, we use this technique. And so I'm going to ask you to lower your face, so don't look straight at the screen. You could be sitting or standing. And I either want you to bring both your hands to your heart, or one hand to your heart and one to your belly, or rest your hands wherever you feel most comfortable. Pick a point to focus your eyes. whatever feels most comfortable for you. And just start paying attention to your breathing. Notice how each inhale and each exhale moves through your hand and through your body. Let's take 3 collective deep breaths. Breathe in and breathe out. Breathe in and just let a big sigh out. And open your eyes, look at the screen and smile. Okay. Stay there for a moment and think about how did you feel? Well, the poll is disabled, so I'm gonna stop sharing and I want you to tell me how you felt. You could tell me in the chat, or you could raise your hand or start talking. How did you feel after the 3 collective breaths? Calm. Thank you, Tiffany. Calm, Liz. Centered, Sammy. Grounded, relax, centered. Sleepy. Sometimes it can make you feel sleepy. I usually have the learners stand up for this activity, especially if I'm teaching after lunch. Yes. That did not take us a minute. That did not take us a minute. So think about how you can use that 3 collective breaths every day to center yourself, to ground yourself, to calm yourself. It's a tool that's very effective, costs you nothing, simple. So I encourage you to incorporate the 3 collective breaths because that's a realistic thing we all can do. All right. Most of you may notice already from your PA school, I teach leadership and advocacy in my program, and I also teach the PA professional practice. And in there, our learners take the 3 that are highlighted. And I do that, just realized I had stopped sharing, hold on. The 3 that are highlighted, I have our learners do that. And the reason I do that is I want them to have a place to hear about the impact of burnout that's not coming from me. It's not me they're hearing it from other voices. And it really helps them to start thinking about what can they do individually based on their lived experience and what they can do at home. I have learners who have children and partners. So their ability to go to the gym is probably very limited if they're even going to the gym. So find the thing that works for you. Your PA school may be having you do this now, or you may want to choose to do it on your own if you're a PA member. So self-care plan. So what do you do now for self-care? Either call out or put in the chat. What do you do now for self-care? Lift, yoga, shopping, kids. Oh, I love the tub. Ukulele, I love it. Watch TV. Hopefully it's a relaxing show. Lots of Netflix, gym and church. Nap, and ice cream. Great. All right, good. So you do have some good self-care plan. Now, here's the question for you. I'm going to move to the next slide, and I want you to think about this now. When you think about mind, body, soul, and you think about what you're doing for self-care, I want you to keep this in mind. Your mind is about how you feel, the thoughts that come through your head, and how you perceive. Your body, when we're stressed, as Dr. Tab talked about, right? Stress, we have normal stress related to PA school, but then there's the real stress anxiety, especially with tests taken, that really impacts our brain, our heart, and our lungs, right? So if we're in a test, preparing for a test, heart starts racing, we start getting palpitations, some people get short of breath, that's where the breathing helps. And then it's almost like our emotion start to spin out of control because we're trying to grasp, like, what do I do? So our mind, body, and soul is very much tied to each other. So how we feel every day matters in how we present ourselves to PA school, to our patients, to our loved ones. So it's really important that we understand the importance of the three connectedness and that we can't separate them. Okay, so keep that in mind. When I was in PA school, this is my self-care plan. This is 1992. There was no social media. So of course, that shows you I didn't have the social media to really help me to de-stress. And these were the things that helped me. Music was crucial for me because we didn't have Facebook or TikTok. And so I went to a PA school where I had 3 roommates, and before an exam, we would be in the car in the parking lot singing "Oh What a Night" by Frankie Valli before we went in to take our tests. It was our way of de-stressing before we went in to take our exam. My family was really important. And my friends were important. Now, that being said, my friends were pretty much almost limited to PA school. Like, it was, my 3 roommates were like my friends. I had other friends, but really it was limited to my roommates. And then my fiance really understanding that I was in PA school. So this is sometimes, for those of you who are pre-PAs on here, I saw many pre-PAs, which I really like to see that you're here now and kind of getting these tools. Is letting your family members and your partners know, I'm going to PA school. This is what studying looks like. This is how much free time I'm going to have, so they can support you. And then I just love reading books. And so books are common for me when I'm stressed. I read a book and I feel better. So that's what worked for me in PA school. That may look very different from you now, but I want you to see what this looks like when I was in PA school and what I do now. This is what I do now. Now you may say, oh my God, Dr. Salahshor, that's too much. I mean, how are you able to do all of that? But the reason I have all of this here is I never do all of them all the time. And I give myself grace. I don't go, oh my God, I didn't exercise today. I can't believe it. I don't put myself on trial, because that doesn't help my mind, body, and soul wellness, right? So I use all of these, though, to support me in my wellness, or I remove some of them to support me in my wellness. And so we need to be really realistic about the role of different people in our lives. So for instance, if I listened to my sister, my family would consume all my time outside of work. Well, that's not going to work, because I really want to go to Orange Theory 4 times a week, right? So I got to figure that out somewhere. If I followed my partner every day, we'd go hiking. Well, that's not realistic, because I can't go hiking every day because I have work to do. For instance, here it is Saturday and we're all here, right? So that doesn't always work. Meditation and mindfulness is something I do try to at least do in the morning or in the evening. But I don't, again, crucify myself if I can't get to it. Music, I go to music when I just feel like nothing else is going to work and I need to disconnect, and I will literally be in my office dancing to Beyonce, because that's what makes me happy. I even have like music now that says positive music from Apple's iTunes. So I have all these little, what do you call them, playlists that I use. So I say this to say, if you look at here versus here, it's significantly different. But what I have learned is I need to have a lot of options. And if I don't do something, I don't hold it against myself that I didn't do that something that day. Okay. Gratitude journal we'll talk about, really helpful when you're in PA school. Now, what are the barriers? What are the barriers to you achieving self-care? So I'm going to stop sharing. And I think someone is going to say, time, Sarah. Yep. I figured time was going to be the highlight of the day. Guilt. I want to hear a little bit more about what that means. And I think it relates to time, but I'd love someone who put guilt to speak up about why guilt. Is it because you feel guilty for not spending enough time studying?
I feel like when I take a break, and take even just an hour, like that's an hour I could be learning something. That could equate to me missing 3 questions on a test.
Yeah.
That could mean I could fail. Like I just feel guilty for taking time to myself and not putting my studies first, even though I know in the grand scheme of it all, like an hour is not going to make that big of a difference study-wise.
Yeah. So Alyssa, is it, and I don't mean to put you on the spot, is it that you associate the guilt with looking for a certain grade, or what is the, because you said it, you said, I know I need to take the break, but I feel guilty taking the break. What is it that stops you from taking the break?
I feel like if I were to take the break, I would not be spending my time studying, and that could maybe be the difference between passing and failing, or knowing something and not knowing something.
Okay, all right, okay. So anyone else agree with Alyssa? Okay, all right. All right, and then time. What about time? Someone who put time. What's the issue with time?
I feel like it's also similar for me, like, because I put time, I was like, oh, I don't have enough time to do studying and to do working out and to like have a little vibe session for myself and also still do well academically.
Yeah.
Like, I feel like, oh, I'm wasting so much time doing self-care when I could be using this to apply myself more and study more, especially like I'm very guilty of comparing myself to others. And there's always somebody that knows more than me. I'm like, oh, if I didn't just like watch that movie last night, I would have known what they know. And like, how come I don't know that? It's because I took that time off. So
Yeah,
it's like a combo of both.
Thank you for sharing that, Sarah. Anyone else? Barriers to self-care, time, guilt. And someone put in the chat, I saw guilt from not spending time with the family. That's huge.
Yeah, I didn't put guilt. I didn't put that one, I don't think, but I just agree with the time and the guilt thing, because even when I want to take like just an hour to like relax, I feel my anxiety build up that I'm not learning and I'm just too nervous and I don't think I'm gonna do well. So then I just like cut the break short and then end up start studying again, because I feel like if I don't do it now, I'm never gonna learn it. And then it just like, it's like a culmination, and then I can't even enjoy the break. So I was like, why spend time on a break I'm not enjoying? And then I just start studying again.
All right. So all the directors who are PAs now, can you tell me in the time you've been a PA, I've been a PA 28 years, 29 years maybe this year. Has a patient ever asked you what your score was on the PANS and what your GPA was? Sonia, you're right in my lens. Has a patient ever asked you that?
I haven't graduated yet, but no, not in my rotations.
All right. What else? Who else? No patient in all the years I've been a PA, a patient has never asked me what was my PANS score, what was my GPA. We put so much pressure on ourselves. We put so much pressure on ourselves. See, Harrison has been around 10 years. Harris, we don't have patients ask us that. So what I tell my learners now, it's something you have to intentionally choose to do, because you have to intentionally choose to say, when I leave this PA program, let me even push back a little bit. You're not going to see half of your classmates when you leave PA school. So don't worry about what they know more than you. But seriously, you're not going to see them. So who cares? Okay. That's number one. Number two, create a different culture for your class. Create a culture that says, we're not going to talk about our grades. We're going to talk about, as soon as this test is over, we're all going to take a walk. We're going to do something else to not even focus on the exam. Create a different culture in your class, because if you get burnt out in PA school, you're going to be more hard pressed when you become a PA to survive. So you have to let go of this grade. Everyone just wants a C. Nobody cares about anything else. You just need to pass every course, Don't worry about the grade. Pass the pants. Don't worry about the grade and move on. That's your goal. So you really have to change the culture of your own thought around grading and what does time off mean. Now, many of you talked about time feeling guilty. The studies show that our brain cannot take so much content in that no matter how long we study for, it's not sticking. So even if you take a 5-minute break, not telling you to take 30 minutes, I'm telling you 5 minutes just to do that breathing activity we just did. That's self-care. So it doesn't have to be something, you don't have to go to gym for an hour. You don't have to go to the gym for 40 minutes. You could take a walk in your building. I think I saw someone talked about where they live in Minnesota. I used to live in Florida and it was hot in the summer and I had migraines and I just could not function in the heat. I would walk around in the building. I tell my learners now, when it comes wintertime, we are not going out in upstate New York to walk around, most of us anyways. Walk around in the building, walk up and down the stairs. You've got to like begin to create little small things that you can realistically do that doesn't take away time in your head. How many of you play TikTok? Let's see, raise your Zoom hands. Okay. All right. How long does TikTok take you, Sammy? You're right in my screen. So Sammy, how long does TikTok take you?
I put a 30-minute timer on it.
But does it relax you? Okay. So there's nothing wrong with that. You need to do these things for yourself. You need to do things as a class so that, for instance, that collective breath, whoever your wellness, I saw someone who was signed up as a wellness coordinator for the class. We do this in our class. So our wellness rep will have them do breathing activity, meditation, mindfulness, and we'll do it in the class. I offer my learners yoga class because just got my yoga certification 200-hour. So we've incorporated mindfulness in my class as a routine. And the reason I did that is we know the culture around mental wellness and self-care is so stigmatized for healthcare professions that we have to begin to change this narrative. We've got to speak differently about it. I recently put a little circle on the board in our classroom where I said, you must be physically well, mentally well, and sexually well to be completely connected to your mind, body, and soul. That's what we need. And if we're not getting that, we're not going to sustain ourselves and we will end up in burnout. So those are the things we have to be thoughtful about for ourselves, because otherwise we're not going to make it. Right. So being okay with that and being okay with saying today was not a good day. I mean, I've gotten up in the classroom. We had a recent death in my family that just brought us all to our knees. And I just said, today's not a good day. Dr. Salahshor may not make it through the lecture. If I don't, you are responsible for the PowerPoint presentation that I have today. And I let that be. The reason I do that is I want to let my learners know that even I, a mature 30+ practice year PA, also have mental health needs that I need to have addressed. And I want to normalize the need for mental wellness to our learners so they can normalize it for themselves. So I really want you to be thinking about this. You can, some of these things we're going to get to, you can get them done in no time. So just think about it. And you have my number. This is mindfulness pause. Look at how long this takes. Just pause it. And breathe in. And it's over. That wasn't even 30 seconds. You can do that when you're studying. So self-care is not selfish. Chair yoga, get your faculty to incorporate chair yoga. Ask your faculty, is it okay for us to do a minute of chair yoga? Especially been sitting in a lecture 3-4 hours, we have these 4-hour block lectures. We need to get up and move, or we need to do some movement of our body. So chair yoga, this takes 1 minute. I was at a PAEA conference, this woman did it. I do a yoga at my desk. I'm at my standing desk right now. It's 17 minutes long. So the days I don't go to the Orange Theory, I do yoga in my office and it's 17 minutes long. When I go to Orange Theory, it's 45 minutes long. So thinking about what you can do. Stretching. Stretching because you've been sitting all day in those chairs, moving that body. It stimulates the brain, and it can be part of your self-care. So let's see, your personal self-care plan. So Dr. Salahshor is going to challenge you all to come up with 3 things you can do that's less than 10 minutes in length for self-care. 3 things. Okay. 3 things you can do that's less than 10 minutes for self-care because of your concern about time and guilt. Okay. You could do this in your class. I don't know if this is going to play, but y'all should know this song. Let's see. I don't know if you're going to hear it. Let's see. Okay. So dance as a class, dance with your kids. For those of you concerned about not spending time with your family, dance with your children. I take my daughter on a hike. She hates it because she's 13 and she hates that I ask her to do anything with me, but I still take her on the hike. You'd be amazed how much I learn about her week that I never would have gotten otherwise. And for those of you who has children, who has kids? How are the kids handling? Are you finished with PA school?
No, I'm in my last stretch.
And how are the kids handling you being in PA school?
I think very well. My daughter is very understanding, and I think she's my support. So yeah. And then whatever time I get, like you suggested, I try to coordinate my relaxation and self-care along with my kids, so we're not missing out on each other and we're not guilty at the end of the day.
Yeah. So I went to see my daughter and my granddaughter. So, just to be realistic, my daughter sent me a picture. She was at the doctor's office and she was on the computer at the doctor's office. And my daughter said, "Why are you on the computer?" She says, "Being Gigi." And so my daughter's like, "Oh my God, even Savannah, even Sloan knows you work all the time." So I was like, "Oh my God, this is so terrible. I don't want my granddaughter to have this as like the thing she remembers." So the last time I went to see them in Long Island, I said, "We're going to do yoga today." So she's like 5, she's 6, my grandson is 2, my daughter is 13. We all did yoga. And my granddaughter started taking over the yoga class. And so they're teaching them yoga in 1st grade. That's how important self-care has become. So that's a way to include your family in things with you. I set realistic expectation for my family to say, I know that I have to work. So if you're in PA school, I'm in PA school from Monday through Friday. From these hours, I will be home at 8 o'clock. When I get home at 8 o'clock, I still have a lot of work to do, but I stop it to spend some time with my daughter. And then I come back to it. She usually doesn't want more than an hour of my time, if that long, because she's too busy making TikTok videos. So really think about what you can do to incorporate the family in part of your self-care so that you get time with the family, but you also get the break you need and you can kind of partner the 2 together to see. Sammy, I missed what you said and I'm seeing, so I'm going to try to, if someone can clue me into what Sammy said, because I missed that in the chat.
Sammy wrote, one of her preceptors said that his first job was so demanding that his kids stopped drawing him pictures, and that was eye-opening to me as a student to be practicing PA, and that I need to create time.
Yeah. I have little coloring cutouts that I do with my grandkids and my daughter. I bring it into the classroom. My learners, they think, I truly believe they think like, those women like with the hat on their head and they're like all meditation, but I don't care. I'm trying to make sure they don't head for burnout, and I'm trying to teach them that now. I encourage every single one of my learners to get therapy now. You cannot navigate PA school with all the pressures of time, guilt, expectations. You just cannot navigate it with some kind of talk therapy. I have a therapist. I meet with her once a month. When I go through crisis, I increase my meetings with her. It has helped me not to need medication to this point. but my sister takes 2 medications for depression. And I share that because I share from teaching mental health first aid. She's given me first permission. And she was doing 2 medications and she was not doing talk therapy. She's now doing talk therapy and her 2 medications. And she's seen that difference. Talking to someone is so critical because you need to go to a place where you can vomit all the stuff you're thinking, that classmate that you hate because they keep talking about how smart and great they are and you're sick of them. You want to go somewhere to talk about it where it's not going to get back to the classmate. You have to offload somewhere. So you need a therapist. I can't highlight that enough. This is focused breathing. So you saw, I left it on the screen so you could see that. All right, did I stop sharing it? If you have a pet, cats are great for PA school. Don't get a dog because it's work. So get a cat because they're great. They're great for anxiety. This is another breathing activity. It's on the list that Karina will send you. Grounding is great to center you to start the day. And so this is very useful for like people with headaches as well. I have migraines, so this really works really well. So grounding is one of the techniques. Again, it takes 3 minutes at most, 5 minutes if you want to do it longer, but grounding is a great technique. Grateful. Today, I'm grateful for you all listening to me. Today, I'm grateful to have the opportunity to be with you. You will not believe how gratefulness helps to center you. It's a reminder of sometimes, no matter what we're going through in life, that we have so much to be thankful for, that we have a place to live, that we have clothes, that we have food. We take so many things for granted. I did this activity when we were locked up, I call it locked up during COVID, because I really felt like we were locked up during COVID and had no life. We did this activity as a family. We talked about what is one thing we're grateful for, and we had to come up with something different every day. And I cannot tell you how it helped our family to even be closer than we already were. Many of you were talking about this. I want to just remind you, self-care is not selfish. What have you done for yourself lately? When was the last time you took a nap? I saw some people put that in the chat. A quick 30-minute nap can be just, ooh, that can just wake you up for that 4-hour study block. And please be more compassionate to yourselves. So important that you show yourself compassion. Because if we can't be compassionate to ourselves, we can't be compassionate to our patients. And so if you remember when Dr. Tab spoke earlier, she talked about stress leading to burnout, right? So you're in normal stress, most of you now. Some of you might be a little bit more than normal stress, but you don't want to get to where you realize you're at abnormal stress, anxiety, depression, you don't get it addressed, and then now you're in burnout. These things we just talked about will help you to stop that cycle, right? That negative thinking cycle, that's, setting these expectation cycle that your patients aren't holding you to, that your faculty is not holding you to. If your faculty is holding you to it, text me so I can tell them stop. We really have to be more thoughtful about taking care of us each day so we can be better providers, better people, better individual, and better to ourselves. So really hyper focus on self-care because it's not selfish. So I'll stop there. And I didn't see all the comments. So if anyone wants to just kind of open it up to questions or comments.
Sarah?
Hi, yes, I have a question. How would you recommend someone go about changing their medication well in PA school? I'm on the top dosage for my SSRI, and I need to change medications halfway through the year. Do you have any advice for handling that?
Yeah, Sarah. So I would say the thing to be careful about is when we're in PA school and we're PAs, we like to diagnose ourselves and treat ourselves and adjust ourselves. So if you are on an SSRI and you have primary, you should either be talking to your primary. A lot of practices now have behavioral health integrated in the practice. And if they aren't, you should be talking to a provider.
Right. My psychiatrist wants me to switch. Do you have any advice for just handling the switch during PA school?
Yeah, so I would say telling your faculty advisor that you're going to make a switch.
Okay.
Let them be aware, because you may have different side effects. So you want them to be aware on the front end of what's happening. And then you yourself recognizing when you may need to step back and say, ooh, this is not a good day. I need to step back and have a conversation with my faculty advisor or talk to my psychiatrist. So that's what I would recommend. And thank you for sharing.
Thank you. Thank you.
And Jennifer wrote in the chat, how can students thrive mentally in a program that seems to cultivate a culture of negativity, be it racism, favoritism and bias?
Yeah. So Jennifer, I'm going to say that's a hard one. And here's what I would recommend. And I'm happy you can text me if you want to talk offline. I find that perception is not reality, but it is reality. There's a lot of times people feel like things are a certain way, but they don't necessarily have the right information. The biggest thing we're finding in PA education is many of us are not addressing our unconscious bias or our conscious bias. And so we're not really authentically having true conversations. So the first thing I'd say is, can you truly say that your program is addressing their unconscious bias? And if they are not, then you need to recognize they are not addressing it. And do you have like an advocate or someone in the program you can talk to about what is happening? The second thing I'd say is, you may not be able to change the culture. We've talked about this across the nation about creating a safe environment for PA students, but many people talk about a brave environment. The honest truth is it's hard to create brave environment for students when there are people in power telling the students what they need to do. So I'd say you need a therapist, because your therapist is going to be that place that you can go and have these conversations. You need a support system like what you have right here. What you have here, I did not have when I was in PA school. So using this resource to help to support you on those difficult days. You are probably going to be challenged to try to make a change in your program without an advocate. So I'd say probably reach out to me and let's just talk a little bit about what's happening where you are and see if we can come up with some tools and maybe some conversations you can have that you're not challenging people, but you're having a conversation because you want to see change, because you want to see change for the students that are coming behind you. And really, as a professional, we want to see change in the long term. Yeah. Unprofessional behavior gets thrown around often and creates fear for students who have professionalism integrated into their grade. So that's across PA education. Our PA requires us to have professional behaviors addressed. The studies show that, especially post-COVID, we've kind of lost this professionalism piece. Now, we also know people are using that term to say, don't challenge me, right? Because if you challenge me, you're unprofessional. So what I will say is you really have to be honest about what is it you're trying to accomplish. I tell my learners, if you have an issue and you come to me and have a conversation with me, I will listen. I may not like what you have to say, but I will listen because I'm not perfect, you're not perfect, and maybe we're misunderstanding some communication. So I would say that's the first step. The second step is if you're still having problems, maybe saying, okay, I don't think this is a professionalism issue, and call it what you think it is and say, this is how I feel. So don't tell them what you think they're doing, but say, when you do this, this is how I feel. Your program should have a professionalism rubric that really speaks to what they're grading you on. It's one of the things our PA looks at to make sure that we're objectively looking at professionalism. So that should help to have the conversation. PAEA and folks like myself are continuing to have conversation with faculty at programs to say, you cannot create an environment where learners and students don't want to talk to you. It's irresponsible for us as educators. We're leaders in this realm. So again, if you feel scared, maybe again, reach out to me. And, you know, if I know somebody in a program, I try to do a reach out. I try to have some general conversations without making sure no learner is targeted. So I'm happy to do that as well. I see a hand up. Is it?
Gotcha.
Hi. I just wanted to thank you for coming. I really liked everything you talked about maintaining, you know, the mental health. I was wondering if you had any advice for us as like future PAs that are going to go into the workforce, for things to maybe look for in workplaces that where they would, you know, maintain and encourage like mental health.
Yeah. So I will say back to what I said, before you get to any job, you need to have a therapist. You need to establish with a therapist before you get to any job. Because the first thing is that first 3 to 6 months of working any job is going to be horrible. You're going to be stressed. You're going to be new to it. They're going to put all this pressure on you and you're going to be scared. So you really have to just make sure you have the support on the front end. The second thing is making sure that you have coverage for mental health. So what is their health insurance plan? Do they have EAP, this employee assistant program? What resources do they have? Do you get at least 2 weeks vacation? We talked about that in the previous talk of having time off. When you take your vacation, are they going to leave you alone? And you want to make sure you have that conversation. And then always be, if at 3-6 months you realize, this is not working, don't quit. Just start looking for another job because it probably means that's not the right fit for you. And you just need to make that decision and being okay with that. I left a job because my doctor was working me too hard. And I went to him because I really loved what I did. And he says, do you think you can make more money doing less work? And I said, I don't care about the money, but I care about the time with my family. And I did get another job and made more money and did less work because it was in a health system. And so, and he never hired another PA. So there you have it. So he really did bad by himself, you know, right? He really, I don't want to get a recording, so I don't want to use bad words. So my point is, be okay with doing what's right for you, because in the end, you want to practice 40, 50 years. How are you going to do that? Okay.
Thank you.
Thank you, Dr. Salahshor, so much. Her information is in the chat, the contact info. I think we'll put it back up again because there was a bunch of convos. I'm going to introduce our 1245 speaker. Harrison Reed is a critical care PA, educator, writer, and researcher. He graduated